Wonderful. Good afternoon and welcome. We'll go ahead and get started. We've got a nice group of people that have already gathered, and we're looking forward to the time we'll have together today. So we want to make the most of it. My name is Leslie Parkins, and I lead Duke Civic Engagement in the Office of Durham and Community Affairs. And I'm so glad we're gathered today for our Lunch and Learn session. These sessions are hosted by the Community Engaged Scholarship Collaborative, which provides opportunities for scholars and partners from the campus and community to learn from one another and to share expertise and lessons of partnership and impact. The collaborative itself is a partnership with Duke Service Learning, Duke Faculty Right, Forum for Scholars and Publics, the Social Science Research Institute, Duke Global Health Institute, and the Clinical Translational Science Institute's Community Engaged Research Initiative, as well as Duke Civic Engagement. And before we start, I do want to acknowledge Liz Shapiro-Garza, who, in addition to serving as an associate professor for the practice of environmental policy and management, is also the faculty director for Engaged Scholarship with Duke Civic Engagement. Liz will facilitate questions following the presentation today. And as we get started, we do ask our participants to please add your name and affiliation in the chat so we can better know who's here today. And I'm delighted to introduce our speakers who will discuss a university community partnership created by Duke faculty and sustained through collaboration with students and partners in Pamlico County. I'll share some brief bios on team members that are with us today. Sumi Ariely is an associate professor of the practice of global health and serves as faculty liaison for Duke Global Health Institute's partnerships in Durham and in surrounding communities. She works with students, faculty, and community partners who are interested in working with DGHI on community-centered research focused on health disparities. Bob Fuller applies his 30 years plus years of experience in industry, entrepreneurship, and nonprofit to improve nonprofit organizational sustainability and effectiveness. He currently works with Pamlico County Disaster Recovery, the Pamlico Chamber of Commerce, and Friends of the Library, among other organizations. And Diana Silimperi is an international public health pediatrician, epidemiologist, and global health thought leader with 35 years of experience in leading the planning, design, and implementation of integrated healthcare service delivery and health system strengthening programs in more than 50 countries. And Nick Haddad is a junior majoring in environmental science and global health with interests ranging from community health to the impact of environmental events on the health of vulnerable individuals. Nick served on the Pamlico County Student Research Team project this past summer and has continued working with the community this past academic year. Welcome to all of our featured speakers. We look forward to hearing your insights on the ongoing development, methods, and outcomes of your collaborative work around environmental health. We will have time for discussion to understand how such partnerships can be created and sustained ethically and efficiently. And I'll now hand it over to our speakers to share their stories of partnerships and lessons learned along the way. Hand it on over to you all.
Great. Thank you again, Leslie. And to reiterate, my name is Nick, and I'll introduce myself a little bit more in a second. But today we're going to talk about the partnership that we created with the Pamlico County Disaster Recovery Coalition, and that has continued over this past academic year. So just a little bit about where we're going. So first, we're going to introduce ourselves, a little bit about the project, about the Pamlico County Disaster Recovery Coalition, the PCDRC, as we'll probably be referring to it as. Then we'll go into a little bit about what we found. Part of that is what we learned about how to go through day-to-day collaborations with the PCDRC and with our student team and with the faculty that are involved as well, Dr. Ariely and Silimperi. But a lot of it is also just concretely what we found through the work that we did. And finally, we'll transition into more lessons learned about partnerships like this in general, about how to engage people, how to be equitable, and how that has played out throughout our time in this project. So really briefly, my name is Nick Haddad again. I'm a junior here studying environmental science and global health. And I had the privilege of working with Dr. Silimperi, Dr. Ariely, and Bob this past summer in Pamlico County for 9 weeks. And I'll touch on that a little bit. Another team member of mine, Advika Kumar, has been working on this as well. And she couldn't be here today, but we have worked extensively on this and are excited to share it with you. So really quick, Dr. Silimperi, Ariely, and Bob, if you'd like to introduce yourselves, feel free.
Well, I think that we already had a nice introduction, so I'm not going to repeat that, but I'll just add one other quick thought for folks to realize. So after over 3 decades of working in low and middle income countries, largely focused on underworld health and reproductive health programs, I shifted to health system strengthening, focused on access, quality, and impact. When I retired from my international career about 4 years ago, I returned to North Carolina, where I had attended Duke, undergrad and med. And instead of living in Durham, I'm living in the North Carolina rural coastal town and county of Pamlico. The reason I'm mentioning that is because, lo and behold, when I returned, I discovered many of the same conditions and challenges, access and quality in particular, that I've been working with for decades overseas. Discussing this with Sumi, because I came back to Duke and also joined the faculty, voila, basically the Pamlico Rural Health System Experiential Learning and Research Platform was born. And you're going to hear more about that today. Over to you, Sumi. You want to add anything more?
That was great. We'll, I'm sure, get into details as we go through the slides, but just again, I'm Sumi Ariely. Great to be here. Thanks so much for Leslie and Liz for inviting us to talk about this project.
And Bob Fuller, as you know, I've been introduced, so I will pass it on back to Nick for moving on into the program.
Great. So before we dive in, we wanted to share a little bit about the platform that this was built on, which has to do with DGHI's Local is Global initiative. And so this initiative is really centered around translating a lot of global learning and global interventions that have been had to the local area. A lot of the same issues as Dr. Silimperi mentioned that exist globally also exist right here in our backyard. And this is a really great way for us as students and also faculty to contribute to the local community and learn a little bit differently about how these issues might apply here in the United States, even though the United States is such a different environment than a lot of the countries that professionals work in global health. It does face a lot of the same problems and has a lot of the same infrastructure challenges. So being able to translate that back here to North Carolina is really important. As a student, why is it really critical for Duke to work locally and for us as students to work locally? First off, as many of you know, institutions like Duke kind of operate as ivory towers and are a little bit removed from the communities that they work in, and the findings that they present aren't often shared with those who they involve. So being able to work locally kind of erodes that a little bit, and hopefully allows some of those findings to trickle down to communities so that they could better themselves as well. Global health also has a lot of colonialist roots, and so we often work in other places, but forget that a lot of those same issues exist right here. And so this is a way to address that as well. And as a student, a lot of the principles that we learn in class and a lot of the interventions are in very specific countries that are usually lower middle income. And so taking those and really applying them to a real world situation, but also a real world situation that we're familiar with, is really, really important and has really taught me a lot in the field of global and public health. In a relationship like this, again, like in global projects, it's important to center local partners' needs and voices. Academic institutions like Duke, again, being kind of ivory towers, can neglect all of the stakeholders at the table sometimes. And so being able to really center around them is important. And just being transparent. Academic work can be shielded from the community. So making sure that all methods, findings, and kind of objectives are clearly shared is important. Dr. A, is there anything you would want to add about this, given it is an initiative that you lead right now?
That was great, Nick. Thanks. Yeah, so it might be helpful just for a second to give the framing. You know, we always try, I think, across so many units at Duke to engage in places where we feel pretty confident there can be deep community connection and partnership. And when DGHI decided to formalize a commitment to local health disparities and work in 2019, I happened to be the one wearing the hat to help champion or guide it. And two of the health issues that we felt were really important to our local communities was environmental justice, especially in the face of climate change, and category 2 diseases like heart disease and diabetes. And so as Diana mentioned, when she was joining the faculty, it really looked like there was a great fit in terms of aligned goals and community interests and need in Pamlico, as well as our Duke translational science and educational training goals. So it was a place where we felt we could have a sustainable long-term relationship and impact. It met the criteria that we always look for when we're thinking about where best to develop expertise and partnerships. We were focusing originally on those two goals. We've come back full circle. When COVID came, we pivoted to vaccinations and COVID-related issues. And now it's great that we've come back to some of our original ideas.
Great, thanks for adding that. And I think it's really important to get that context as well, because it's relatively new, but the impact that it's had in its short time is pretty profound. Really quickly, just talking a little bit more specifically about how this got started. So there were a lot of different learning platforms that contribute to this greater Pamlico County platform that has been developed. And it all started with a Basque Connections team back in 2020 to 2021 that focused on community-based response, really around COVID, but also around different non-communicable diseases that exist in the community. And again, working with Pamlico County and many of the same community partners that we worked with this past summer, the health department, Hope Clinic, and the community or COVID Community Task Force, CCTF, that was created out of COVID, but it was a coordinated group that sent communications and sent out supplies to different residents throughout the county. And that force really catalyzed the involvement and eventual expansion into the PCDRC that we have continued to this day. Beyond the Basque Connections team, senior capstone teams who are majoring in global health have worked on this project for a shorter time commitment, just one semester, but it allows them to engage with a rural community like this and has contributed to our project specifically through the drafting of a survey that we'll talk about in a minute. The program that I was a part of, the Student Research Training Program, serves as an experiential learning activity for majors like myself, but how it differs from the other two is that it's all about on-the-ground field work. And so we got to live in Pamlico County for 9 weeks and work with community partners on the ground, which really lent itself to catalyzing the change and the impact that we wanted to see. And finally, after this program, my team member Advika and I have continued with independent studies, which is just another way to engage with this platform as well, and transition to new teams, which we've started doing with the next incoming SRT team. And really briefly, again, this project was not just with the PCDRC, but we're going to focus on that today. We also worked with the health department to assess unmet health needs in the county by conducting a gap analysis and proposing some solutions both to them and to the health advisory board in the county. We worked with Hope Clinic, which is a nonprofit free and charitable clinic serving uninsured patients in the Pamlico County region. And we worked with them to identify their own needs, but also to develop a mobile care model that they're piloting right now. And finally, the Pamlico County Disaster Recovery Coalition, our focus for today, which I will let Mr. Bob Fuller talk a little bit more about. But we worked with them to survey some different people and really collect data to inform their next steps moving forward. So Bob, if you want to talk a little bit about the PCDRC, feel free.
When I envisioned retirement, it included a long list of recreational activities. And that proved short-lived when among those things that happened to me moving here with my wife were devastating hurricanes. And among the things that the county was desperately in need of were efforts to fix, repair the home damage that resulted from those hurricanes. And so the recreational side of my vision quickly left, and I really got involved with the Disaster Recovery Coalition. Over the time that we've spent since Irene and then through Florence, there have been about 500 plus homes that we have been in touch with to rectify some aspect of the disaster they endured. The major focus of what we've ended up doing has been to repair homes, homeowners. We are focused on home ownership and the repair required for continued living in their homes. And of those 500 plus, we ended up having repaired 266 of those homes. That's an ongoing process, and we have been very fortunate that we did not get a hurricane last year, so that we've been enabled, we have continued our work. We have probably 40 more homes to go with money to support that effort. But the thing that ended up being the most engaging of all of that has been what the students added to this whole process, which gave us a real leg up on getting a hold of statistics, getting a hold of engagement, getting a hold of feedback, getting a hold of all the things we never had time to do, just doing the job of repairing the homes we had dedicated ourselves to fix. So the students became absolutely a way important factor in the whole thing. Just to give you a hint of how important that was, it wasn't long after they were here and meeting everyone in the community that people were coming up to me asking how soon they could replace me. So it was a very positive engagement.
Thanks for sharing that, Bob. And to talk a little bit more about how we engaged and where we worked. So the PCDRC office is located in Bayboro, which is the county seat. And we worked with them every day. That was our home base. And so being able to show up to the office, casually have conversations, but also ask questions as they came up really allowed us to achieve what we did, because working in a new community and a new culture is always different, and having the ability to just reach out, ask questions, and meet regularly with both Bob and Linda, who's the director, really helped us understand what we needed to do to best achieve our goals. As you can see in the picture to the bottom right, the environment really contributes a lot to the project that we've been able to complete. So that's a picture that we took like an hour after it started raining. And as you can see, the whole left side of that road is flooded. And that's really characteristic of a lot of the problems that exist in Pamlico County. The land is really low lying. It doesn't drain easily. On top of this, you have compounding disparities like poverty, the general lack of resources due to the rural nature of the community. And that really contributes to a lot of the challenges that residents faced in the wake of these hurricanes, and that Bob and his team have been able to address. Day to day, we touched base with, again, Bob and Linda pretty frequently. And we typically met in the mornings with them, and being able to touch base before we started our day was really important, as it allowed us to tailor our tasks to what we needed to get done and what Bob and Linda saw most fit. And we'll talk a little bit more about what we've accomplished moving forward, but part of this was refining a survey that capstone team drafted in the spring. And we met with Bob, Linda, and another team member, Ellen, I think multiple times the first few weeks, just to really understand what was needed by the PCDRC, what the local context required, and what people would be willing to answer if we were to ask them questions. After that, we focused more on administering the survey and analyzing, but volunteers from the community and Linda's expertise and knowledge of the constituents that they served really helped us shape our distribution strategy and achieve what we set out to. So what is this survey or risk and vulnerability assessment that we've talked about? Briefly, we wanted to identify some risks at household levels in order to develop preparedness interventions and mitigation interventions that volunteers from the PCDRC could carry out moving forward. And so to do this, we created a survey with 4 different sections: property structure, health status, social profiles, demographic information, and how prepared people were for disasters or their perceived risk. This was about a 20-minute survey that was administered over the course of about 4 weeks. And this data has been used to inform interventions, as Bob will talk about a little bit later. And this is an example of a question that was on the survey. So it actually started a lot differently than this, because the capstone team that drafted this took all of these questions from existing instruments, but we know that a lot of times those existing instruments don't match up to what the community actually needs and what problems exist. And so by meeting with Bob, Linda, and the case manager, Jim, who all have more knowledge about what homes in the area are facing, we were able to come up with this list and also present it in a much easier and more comprehensible way. So who exactly did we reach in this process? Really briefly, we learned that the most effective way to reach people was through a few different approaches. As you can see, 252 households were contacted, but only 66 surveys were completed. And so that number was achieved through a combination of calling, sending out postcards, which you saw on a few slides earlier. We were cutting all of those in the office, and also going in person to these homes, because a lot of people don't have the resources or the time necessarily to call us. So just showing up at their door and really presenting ourselves like that proved to be actually more effective than we thought it would be. And it was clear that we couldn't just use one way to reach people. We processed all of this data into client profiles, which has changed how the PCDRC operates moving forward. And this was piloted this past fall. So a lot of this information that you see, so a person's age, whether they have insurance, whether their income, different home problems like that question asked, are all compiled into kind of a list or a one-page document that different volunteers are able to take out and actually go to these homes and see what problems exist. As you can see also on last point on this slide, in terms of demographics, the population we surveyed and that the PCDRC serves is older. A lot of them don't have home insurance, and they're relatively financially vulnerable. And this ties into this theme of environmental justice. There's these compounded environmental and economic stressors that really contribute to injustices in rural communities like this. Those that have the means to fix their homes or raise their homes are better off when hurricanes strike and face less damage, which ultimately leads to better outcomes. But those without those resources are often left in the dust. And the PCDRC is really trying to bridge that gap. And with more frequent chronic severe weather events taking place, this is only becoming a worse issue and an injustice that we need to address even more. So to survey the 66 completed ones that we ultimately got, we started by breaking people into fire districts, which are these black outlined areas that you see on this map. And this is a map of Pamlico County. You can see that it's relatively small, but water permeates throughout and is in a lot of places that you wouldn't expect. But by breaking this county into fire districts and kind of sampling from within them, it allows for future integration with emergency services and fire departments that exist, as well as serving as a way to group volunteers to a specific geographic region that they might live in. And this is a way to better tackle the volunteering structure moving forward, because different areas of the county have very different needs. And so by allowing people to work closer to where they live, it's just one way to make this a little bit easier for people. Bob, if you want to talk a little bit more about just the geography of the county and why mapping these patients is really important and grouping them this way. I feel like you would probably have a little bit more to add as someone that's lived there longer and knows a little bit more about the infrastructure.
Yes, and I just want to pick up on something Nick just mentioned. He talked about the injustice, the kind of environmental injustice. And this becomes sort of the core of the value of what happened with this experience. When you throw a term out like that, it sounds very academic. And the very thing that happened was bringing that academic term, environmental injustice, into the reality, into the practicality of the whole Pamlico experience, because that is exactly the right term. Without the PCDRC, there is no other service that would help people repair their homes, homeowners repair their homes as a result of the hurricane. And that sounds like an unbelievable thing here in America, but it's exactly what was set out in the early part of this discussion, which is some of the most challenging things we find abroad are not far from our own doorsteps. They are here in our own counties, poor counties. And that collaboration of that academic injustice concept comes into an actual practical outcome when applied here, both with the learning that the students got, but the bringing of the academic world into the practical world of what happens out here on the ground. Nick mentioned this kind of map here, and what you can't see on this map is that the highest point on it is 50 feet high. And that's an amazing high ground for this area. And so what you're looking at is a whole county that's vulnerable to rising sea levels, more intense hurricanes, and the ongoing press, if you will, of saturated grounds and flood levels that never existed 50 years ago. People are living in areas that were just fine for a great number, for centuries. That's all changing. And with that change comes the added need for response in these more organized way through the fire district and through the volunteer brigades to get the help to people as quickly as possible. I'll come back to that, how we expand that as a result from the things Nick is going to talk about with the survey.
Great, thanks, Bob. And I think being on the ground too, I think we didn't realize the injustice and the severity of it all until we went house to house and canvassed and really saw that obviously we were there to ask people questions about their homes and their health, but you saw so many child support needs and different financial strains that we were unable to address, but you just see how all of those things add up. And I think the findings will show that a little bit too. And I'm going to run through these a little bit quickly because there's a lot of numbers, but we're just going to highlight a few main things. So in terms of home repairs and property structure, we found that almost 80% of homes that we surveyed had at least one household issue. So the PCDRC really needs to follow up with a lot of these vulnerable homes, but first and foremost, the ones that are the most vulnerable. And so this client profile process that we developed has enabled them to start doing that. But to do so, they need funding. And so we suggested, and they've carried out a lot of this, to apply for some grants that are specific to risk mitigation and preparedness that could be used to repair urgent needs and support different interventions that address more preparing for hurricanes and natural disasters than actually recovering from them. In terms of disaster preparedness, we found that about 50% of respondents lack an updated medication list. This is something that's critical during a disaster. If people aren't able to access their medications, aren't able to go to a pharmacy nearby, or need to evacuate and leave items behind. And so one key kind of intervention that could come out of this is just distributing medication cards to these homes that are at risk and to at-large residents in the community, signing people up for code red alerts, so county alerts for different disasters and severe weather events that occur, and hosting some different sessions to put together supply kits and evacuation plans, really helping people prepare with some guidance. In terms of health difficulties, we found that about 34% of respondents use medical equipment that requires electricity. And electricity often goes out in these natural disasters for potentially weeks at a time. So there's an impetus to establish relationships with the fire departments and with emergency services so that when these disasters strike, they are able to go out and specifically flag homes and visit homes that have these issues, whether that's going in, knocking on a door to check in on people that are using these types of equipment, or just kind of noting that they're there, making sure they have an evacuation plan ahead of time, different things like that, that considers their specific health needs is really important. A part of this also is mobility with a significantly older population that they've served. Helping to install ramps is really important for homes that are raised to avoid flooding if people are able to have, or if people have the means to do that. So those are two different interventions resulting from this. And finally, perceived risk, which may not seem as important as some of these other more concrete findings, but it's important to identify and understand where people feel the most vulnerable in order to design interventions that best address their needs. So in this case, there's kind of this general trend that people have pretty high perceived risks due to these disasters. And so in these mitigative strategies, we need to account for this. A suggested intervention that we came up with is to increase property maintenance. While we were going house to house, we saw a lot of instances of overrun drains, trees with missing or dangling limbs that were close to homes. And so we could attack these challenges before disaster strikes using some of the volunteers that the PCDRC has and have that they have recruited over time. Part of this also goes back to education, right? Making sure people understand what the risks are and how to take care of themselves in times of need. And so tying those into support groups and some of those earlier sessions that we mentioned is really, really important. And so that was a lot of results, just numbers, but what were these results used for and how did they add value to the PCDRC and to this partnership? Three key things, and I'm going to turn it over to Bob to talk a little bit more about all of these. It helped the PCDRC develop a mitigation strategy, think about health interventions, and also apply for and receive some new funding specific to preparedness. So Bob, if you want to elaborate, go right ahead.
When you look at this list, you might think it obvious that mitigation would be something we would think about, or that health would be something that would be obvious, from the mold that resulted from damp under the joists under the houses. But the truth is, we had all of our energy and the $7 million of both monies and volunteer time devoted to the rear view mirror. we were fixing things. Nowhere along the way were we thinking about what we should be doing ahead of things. And it was really the results of the survey, the results of the students being there, that allowed that discussion not only to start, but to get documented. I mean, it's nice to have really interesting discussions, but without the documentation, it really goes nowhere. And that's what really happened. It forced us to start thinking ahead of the next storm, as opposed to responding to after the next storm. And that critical difference, that mitigation strategy, has a direct economic effect on how well we do responding to the next hurricane. If we get ahead of the curve, if we get ahead of repairs, if we look to homes where we can fix things that, if left unattended, get very expensive when they get ripped to shreds by a hurricane, we're saving money. And given the fact that the money that we need is all coming from donations, from grants, which are uncertain to be at best, and volunteer help, cutting the cost, cutting the time for repair because we're getting ahead of it, becomes critical. And so when you're talking about the value of what happened this summer, that just touches the beginning value to us of how important the simple things that were going on, the surveys, the out in the community asking the questions, talking to people, became for us to modify a repair mentality to a mitigation mentality, to getting ahead of the curve.
Thanks for sharing all that, Bob. And we'll touch a little more on some other lessons that we learned in just a minute. And I think a lot of those play really strongly into that. Just to kind of share some concrete outcomes and where we're at with this project since then. So back in July, we shared all these findings with the PCDRC Executive Board. And since then, there's been an increased focus on prevention, mold mitigation, and really kind of building the capacity and the funding to, building the capacity and funding to address these preparedness interventions over this past semester. And we've worked with them to through an independent study to do so. Sorry, I don't know what's happening. Well, and this past semester, we have transitioned to the next SRT team, which is going to help build a lot of these relationships, continue the relationships, and establish new targets that they're going to reach. So, what have we learned from all of this? So, and we're going to have a little bit of a back and forth with all of this. So first, as a student, I really learned the essential role that nonprofits play in responding to community needs, specifically in underserved communities. But it's also really important to note that their bandwidth is pretty limited, specifically in Pamlico County. There's already a lack of healthcare infrastructure, general lack of resources. And so these really fill in a lot of the gaps here. And Bob, if you want to elaborate a little bit more on some of the gaps that you all fill, and I think you have already, feel free.
I just want to start by noting that after Nick talked about mold, he's been coughing nonstop. Presumably there's not a link to that here. Just one overall observation here. North Carolina has benefited from what are called long-term recovery groups. And those are volunteer groups that spring up at the times of disasters throughout the 100 counties in North Carolina. We're no different. We are similar to the long-term recovery groups, but all of those groups depend on both, like I had mentioned earlier, donations, but most importantly, volunteer help. And all of those are undependable to sustain an organization. Where we end up going with some of the discoveries made and so forth is the creation of a more sustainable organization through grants and mostly grants and foundation monies that have benefited, we've benefited from the studies, the documentation that have come. And the response, the county's now looking at the importance of the long-term recovery as a group that must be in place, because without it, there's nothing else in place to respond to both the upcoming needs, mold and mitigation, but those things that have been left behind from hurricanes past. Nick?
Thanks for sharing, Bob. And I think you echoed a lot of kind of the next bullet or two. The lived realities on the ground are just very extreme, but also you don't really understand them until you live there. You understand the local context. And so being able to have a community partner like Bob and Linda and everyone else at the PCDRC to learn from in that sense has been really, really valuable, and has allowed us to kind of see where they fit into the bigger picture of addressing their needs and kind of serving as a county resource. As Bob mentioned, really thinking about mitigation with the exacerbated impact of natural disasters that continues to be had because of climate change and just their geography and geographic location is really critical for specific organizations like the PCDRC that do respond to those needs. And as an academic institution, it's important that Duke invests in and continues to support these kinds of relationships with organizations that are doing really important work. As a student, it helps us really understand, there are really good people out there doing wonderful things, and we can play a part in that, even if it's a small part, just by supporting them and helping them collect information that they can use to then increase their capacity and do more. At the same time, we've been able to translate a lot of these findings and the feelings that people in the community have into real practice, real results, and numbers that the PCDRC has been able to use to get more funding and other things like that. From a faculty perspective, Dr. A or Dr. S, do you want to talk a little bit about why Duke should continue to invest in partnerships like this?
I'll be glad to start off, and maybe I'll just share one or two other thoughts. I mean, one of the things I'd like to stress from what you presented is that the survey, first of all, because it was multifactorial, if you will, or the multiple topics that you identified that we included, really captured a wide range of information that enabled the team to really identify those households, not by individuals, folks at the household level that were most at risk, and therefore identify where PCDRC should prioritize, because with limited human and other resources, that prioritization was really important. There's a lot more work to be done in that regard, but I think the ability to have that kind of survey, which was based, as you say, on a review of a number of different existing surveys, but trying to pull in key questions that were then appropriately adapted and modified to the area. So, I'd like to stress another thing is that although we're talking only about the PCDRC part of the partnership, that when I answer your question, Nick, in terms of why Duke should continue this, I want to stress that this was a county-wide platform. And it's really what we hope to be a new model for an academic kind of community or civil kind of a structure and organization. So PCDRC is one partner. As Nick said, we have other partners with both the charitable clinic, the health department, and more groups. But the emphasis is on the whole county. This is a Duke Pamlico partnership, and that's somewhat different. Although there are individual streams of work, there are individual, in some cases, research coming forward. It's really developed with an idea of this commitment to the county, a rural county that's diversified, that has, in fact, some extreme poverty, and overall that poverty has a dominant force in the community. But there's also some very well-off, frankly, both educated and economically well-off people. And that it's kind of like a tale of two cities that you see, but it's a tale of two rural realities, and how to maximize and utilize the resources that are there, but really identify and focus on the needs of the more vulnerable community members is really an important element. The value to the county, which we have been told over and over again, are multifold, and Bob identified that in the context of PCDRC. But I want to stress as well that I think the concept of bringing in, of having the students, and which are human resources that the county lacks, right? It's a small county population-wise, a large county geographically. But to bring in people with the ability and the dedicated expertise that the students are bringing to get the data, to get the evidence base and bring in the latest findings is really, really appreciated. People don't have the time or the means to do so. And that evidence base is really proving quite valuable across the streams of our relationships, as well as the literal human bodies. And other elements of this partnership do include now some rotation of student nurses to address, for example, the human resource from the clinical side and public health side as well. But the other thing is that another thing that Nick noted that I want to stress is actually the time and effort spent to identifying potentially grant sources and helping with those grants as well. But one of the most profound things is, frankly, what I've been told repeatedly by friends and residents here in Pamlico, is that the students brought hope. You all brought hope, Nick. You brought a recognition of the value of the lives of these people and hope for the future, which is quite profound. And as a side effect for Duke, why Duke should continue that, as one thing, really Duke has an entirely different reputation in this part of rural North Carolina because of the involvement of the students. I think for those of you who know Coastal Carolina, let's just say they are not Blue Devil fans. They're out there, ECU and NCU, et cetera, but not Duke. And really the whole image and recognition of what Duke brings as a higher Institute of Higher Learning has been really quite significant. Clearly, though, the opportunity for our students, and be they the global health majors from undergrad, the master's students, nursing students, we're hoping also some family medicine folks in the future, they get to have really profound experiential learning, solid development and application of the research skills, but also a profound understanding of the realities of a rural community, the strengths from that community, which are not often touted, as well as obviously the immense challenges. And so that understanding of strengths as well as challenges and the realities of rural life in this country and in other countries is something that I think is very important for future professionals, regardless of their particular discipline. Let me stop there. I think there's more things I could say, but hopefully it's enough. And I want to see what we're going to certainly share with Dr. Ariely, with Sumi.
No, I think you touched on so many of the major points, Diana. That was great. I would just say the mechanics of doing this really requires strategic long-term thinking. We are flexible on our feet. Obviously, we make mistakes as we go along and pivot as needed. But one of the pieces that go along very nicely with what Nick was talking about and Bob was talking about is really thinking through, okay, we have this long-term plan. We want to be sustainable. We want to be committed to health issues that Duke cares about, that the Global Health Institute cares about, that our students care about, that are critical for the community. And so how to do that in a way that allows us to stay engaged over time, and to stay engaged in an effective way over time. And part of that, one small example of that is getting a capstone team over the academic semester to start the framework and drafting. There is no way we could have done a vulnerability assessment survey appropriately and effectively if we had started in the summer. We have 8 weeks on the ground. So having a semester beforehand to do the literature reviews and the literature searches, semi-pilot test it, meet with Bob and Diana and I regularly to think through what might be needed to try and predict what are the kinds of questions that are going to be useful, so that Nick and his team on the ground could then actually refine it. Took them weeks to refine it to get to the point where we could then actually use it to collect data. So I think from the university perspective, obviously our training and educational mission is met by these types of experiential learning goals. As Diana hinted at, we have an ethical mission to be good neighbors in our community and to address the health disparities that we see everywhere globally, and to not pretend that we have the expertise and science to go somewhere else without thinking about addressing those same issues in our own homes. And then frankly, it helps the university think about this multi-directional learning, right? There are things that we understand by being engaged on the ground here that we're able to apply our global expertise that we've been working on for decades in other communities, but then also use the lessons learned here to reapply and think through the international work that we're doing. I think one of Global Health's mission, my mission, I think all of ours, is to help us get out of the way and make these things sustainable on their own, to work ourselves out of a job. And so again, I think the long-term goal would be, how do we empower local communities to get the resources, the knowledge base, and the human resources, frankly. Like Diana was saying, if we can get more healthcare professionals to integrate in and continue doing that, eventually we can move on to doing other things. So I think, Duke benefits greatly from partnerships with people like Bob, both for our students, but also for our own learning.
Great. That was good way to tie everything together. So thank you guys for sharing. And I think at this time, we want to thank you all for coming and just being attentive and listening and allowing us to share our story. Thank you to Dr. A, Dr. S, Bob, and all of the other people on the ground that have helped to make this happen. And to the team members that I've worked with that couldn't be here today. I know they've all worked really hard as well. The 2 QR codes on the screen are for, the first one's for a website with kind of our general project poster and descriptions of each of the different work streams that we worked on. And the second one is to the specific reports that we ended up with at the end of the summer. So at this time, I'd like to open it up for questions.
Thanks. Next, Dr. A and Dr. S, as I heard Nick call you, and Bob, thank you so much. That was incredibly rich. I think having all of your voices and perspectives represented is really important for understanding how the true power of community university partnerships. So thank you so much. My name is Liz Shapiro-Garzer. I'm the faculty director for Community Engaged Scholarship through Duke Civic Engagement. And we are hosting the session today. The session goes until 1:15, and we're now going to open up to a Q&A session for our guests today. There are some questions already in the chat, which I'll take, but feel free to put further questions there or raise your hand with the Zoom function of raising your hand, and I will get to you as well. But let's start with Kendall's question. Curious to hear how your team is thinking about the Duke climate commitment efforts around community-involved research and how to have recommendations and lessons learned from your project incorporated into the university's plan. I'm not sure who is best to answer that, but feel free to jump in.
Yep. So I can jump in initially. And Nick, I'm not sure, given your interest in environmental science and health, if you want to talk about it from the student perspective, but absolutely, I think it's been amazing to see Duke's focus recently on, and it's always been there, but a more targeted, explicit focus. And I think we're hoping over time, this was our first summer. And one of the lessons that we emphasize a lot is for us to first really understand the local needs and contexts and communities, to then figure out how to start integrating in other resources and knowledge bases. And so I think we're thinking after this next summer, looking into potentially formal but informal partnerships with people who are on the Duke Climate Commitment board and partnerships and university committees to think through sharing what we've been doing, what lessons we've learned in terms of specifically this training program that Diana and I have been working on, and then to think through what other resources there might be at Duke from Duke's end as well as from our end. I don't know if that helps Kendall answer the kinds of things you were hoping for us to focus on, but that's our plan.
I would only add to that, although obviously I agree with what Sumi shared, but I would just say if it would be useful to speak sooner, I mean, we're here, and I think we'd be very interested in opening conversations with folks even sooner. But yeah, we'll have more information, more learning by the end of this next SRT, but definitely open to conversation sooner as well.
Nick, did you want to add the student perspective as well?
Sure, I'll briefly add. I think Duke's kind of commitment to the climate now is pretty amazing to see, and I think obviously it's relatively new. There's a lot of infrastructure that they've committed to and have stated, and that's still being worked out. But I think kind of incorporating a lot of these lessons and talking with different teams that have already done a lot of this work to understand how to best proceed forward is definitely really important. And from a student perspective, I think would make it more valuable to kind of design different programs like this moving forward.
Thank you for those observations. That is, again, very insightful and powerful, as well as I think about community university partnerships. I do have a question of my own, but again, our audience members should feel free to put questions in the chat. I'm going to ask my question and then I'll get to yours, Brian. My question actually, I think probably is for Bob and maybe Diana as well. I'm wondering, Bob, you had mentioned that the survey results that were produced through this project and this collaboration were used directly for fundraising. I'm just interested to hear other very specific ways in which those the results and conclusions of that research were actually applied and supported the work that you all are doing.
Some of it is embryonic because it's new and all of that, but there are branches of thought that are leading to specific projects that resulted from the survey material gained last summer. One of them is that we've got a project of incorporating VR technology to zero in on individual home addresses with the imagery of what climate or what hurricane damage can do to their home. And the reason that's essential is that when you're trying to talk to somebody about getting ready for something that sounds like a maybe we're going to have a hurricane, makes it very difficult to get into a mitigation program. And so the results of we need to get into a mitigation program spurred the idea of how. And so my point is that the foundation laid spurred the broader thoughts of how do we engage people in understanding that this mitigation idea is critical to your home.
I'll add to that as well. A little bit tangential initially, Liz, which is that, again, you know, it was kind of bizarre, really, that health wasn't ever even considered as part of, you know, integrated as part of our response. It just wasn't there. And so we're beginning, you know, to develop that. And in so doing, lo and behold, the mold issue became really clear with both environmental, obviously structural and health implications. But it also meant that we have another opportunity to work more closely with the health department that's not doing anything about mold. So that synergy began. And so as we're doing our different streams of work, because we have this broader county focus, we're actually able to develop synergy across partnerships, right? Across organizations, if you will, or agencies as well. That also opens the way for more funding in some cases, right? When you're showing multi-sectoral and multi-agency. I'll also share that Bob will probably talk more, but I think having some of this data and the plan that goes with it, even though it hasn't been it's not fully come to fruition yet, clearly, you know, did obtain some interest from one of the potential funders that I believe we will be getting this summer. So I think there's a direct, ostensibly some direct monies, considerable money, that's not the only issue, but that was, you know, helped for sure to attract that, that funding source. And we do know also with one of our other partners, again, that the data, a lot of the data from other survey work, et cetera, but this evidence and database has enabled, for example, the charitable clinic to get several new grants. Not huge, but, you know, nonetheless significant for the work they're doing. And the health department is also, I think, going to be as attractive the nursing MOU and nursing students, but also looks like we may get a CDC fellow and some additional grants. So, you know, we're beginning to get either direct funding and or human resources that come with funding, right, to assist with these different partners, and certainly including the PCDRC.
Nick or Sumi, did you want to add anything to that?
I think that was right. It really is kind of this multi-sectoral approach. I would just add to what Diana said is that our long-term hope is to help different counties also collaborate and connect and share lessons learned across, so that we empower local communities to take on this work and do what's needed from their perspective.
Yeah, thank you for that. That's really, again, so wonderful to hear both the response and the response to that question about the power of community university partnerships, both from the folks who are on the community side and folk on the university side. I think that's a really great to share those dual perspectives. Let's see, Brian, you have your hand up. Would you like to ask a question?
Hey, excuse me. Thanks, Liz, and thanks to the team for doing, which, you know, you put together a great presentation here. I know it was a lot of work to do this, to actually get there and do real work, and in the real world is hard to do. And Bob, I appreciate the partnership they had. It seems like you had a very productive partnership. But I think my question is for Bob, actually. And forgive me if I missed this, I was a little in and out, but if you had a Christmas list or a wish list, what would be priorities you would do for next steps? What would you like to put the team on next as far as growth or different areas? Would you want to go deeper into this one project, or are there other areas of concern that you and the community are facing that an approach like this might be able to help with?
Because this scratched the surface and exposed the issues, the depth is now beneficial, is now helpful. It as you can appreciate, it underlines the magnitude, if you will, of the issues that we're dealing with. And just kind of touching on, and Brian, I think this is a little off what you were talking about, but when we were repairing homes, we saw mold and figured, okay, we need more sheetrock. When the students come in and say, by the way, I notice there's a lot of mold here, and we're talking to the health department. All what we were not thinking about was what they enabled us to think about. And so that collaborative spin from our siloed view is in part the model that has to get replicated throughout the county for all of these other things. The health component is one of them. The living arrangements, the medication Nick mentioned, the fact that if you're on a heart machine or a breathing machine and the electricity goes out, that's a big deal. And because health has no reach, they can't go into the community. We're in the community, but we had nowhere to go with it. And that's, and Brian buttonhole me, help me refine the answer to your question if I'm missing what you're saying.
I hear you loud and clear. I think you hit it right on the head. And I mean, I'm glad to hear that they kind of scratched the surface and opened up some things to pay more attention to. But I think this idea of crossing between silos is critically important. That's something that our students also need to learn early on as things get more interlaced and more connected. Thank you.
This to me, but if I can just add one little element there, it's interesting in the context of mitigation approach that, so initially, our thinking was more around the health side, right? Really preparedness from health. But as we started, digging into this and really operationalizing, we said, well, there's also preventiveness in terms of the household and the environment. And so although we were totally on a repair kind of, normal journey, we suddenly saw, even in the structural side of things, that was our bread and butter, there was a preventive side of that, if you will, or preparedness side, and not only on the health. So it's an interesting evolution to a broader mitigation strategy that included all the components.
Seems like it'd be helpful to get some engineers in the team also.
Yep, absolutely.
All right.
And I don't know if this is, but I think it's obvious, but they're also, like Bob and Nick were also mentioning, they go to the homes and we see, well, there are financial needs, there are educational needs, there are mental health needs, there are childcare needs. And so how to connect people within a community to the resources that we might be able to notice, how to collect more data, to be able to show the evidence needed in order to get more resources. That cycle has been just really wonderful to be a part of and to work with. And the one thing that I think hasn't been mentioned enough is the reason this has worked so well for our students and for Duke and Diana and I is, one, Diana's in the community, but two, the community partners. I mean, Bob and Linda and their team met with the students regularly. That's not always usual with our community partnerships. Either there's not the time or the resources available to do that. And I think the students got the experience that they did and were able to develop the quality of work output that they did because all of our partners on the ground, Bob being emblematic of it, were right there, 100% working together with them. Not something that Diana and I could have done enough on our own.
All right, thank you for that. Again, incredibly powerful to hear the different perspectives too on what the future holds. I do have one further question. I'm just going to throw it out there, and we have just a few minutes left. Actually, building on your point that Sumi, about the further questions that need to be asked and answered. What are some of the research questions that you still have that you think, or that have, as you said, through this iterative process, Sumi, have been that you have in your heads that you'd really like to investigate, co-generate this knowledge that can then be used and applied to understand the issues that the county is facing?
Sure, I'll throw out one, and then I know the team will have others. One that Nick had hinted on in one of the slides in terms of the perceived risk. Yeah, as a psychologist and community psychologist, I think one of the really interesting pieces is to understand obviously, what do people know and what do they care about? But then also, where is there a match and mismatch between where we perceive risk and where risk actually is? And so I think the educational component, really digging into, if there's only 30% who perceive a risk of flooding, how much of that is based on knowledge? How much of that is based on this kind of chronic exposure to sometimes flooding affects me and sometimes it doesn't, and you can't predict when exactly it's going to come. And then how can we develop strategies to help not only educate, but then create predictive models to say, here is where it's likely to happen, and educate the community, right? Really use this as a way to spread this knowledge that we have really a privileged access to develop. So that's one. I think the mental health focus is another. So these compounding effects, when people are stressed in one area of their life, that impacts the ability to address other aspects that might seem pretty straightforward. And so how do we kind of break open those compounding effects the most effectively? So those are just two examples.
Yeah, I would-
Diana or Bob? Yeah, sorry, go ahead.
Yeah, no, I agree with both, but particularly the mental health. I mean, we're just beginning to really address the deep and broad mental health issues in the county. When the capstones began looking at the mental health gap, but clearly in the context of, climate change and the adverse effects to a large number of families here, that's an added element. So I think there's lots around mental health that we need to better address, both in terms of mitigation to some extent, but certainly preparedness and later appropriate interventions. There's another element that's linked though, and I think that really the model that Bob is developing, which brings in volunteers from the community on a regular, more systematic basis. Also, though, that direct partnership, which we hope to bring to fruition with the fire department and the emergency management and the health department, which sounds intuitively obvious, but doesn't happen. And in fact, I've learned to my chagrin that in particular, the health side, the public health and health side, and the emergency response side aren't aligned. They weren't aligned during COVID in many counties. We found out because, as Sumi alluded to, we're also bridging out beyond Pamlico and looking at kind of a coalition of broader coastal counties. And so in the context of disaster response and a kind of modified delivery model and testing it, which includes that kind of integrated synergy and utilization of emergency medicine as emergency response team, and the county health clinics is really important, along with the PCDRC as the community partner.
May I say one added thing? All this is interesting, valuable, but the art of communication, looping in the communication department on how you get that message translated into practical, ongoing, widespread messaging to the community, who is, by the way, challenged receiving messages. We don't have an internet out here, but that's very effective. We don't have a communication system. That it is why we ended up looking at VR, because we're partnering with the library with the 30 headsets they have to see how we might expand the visuals and communication at the university can be more, pulling in all those folks that are learning that skill to apply it here would be great.
Thank you. Yeah, again, hopefully some folks on the call today will be taking you up on your offers to take on really very challenging, incredibly powerful partnership. And again, co-production of knowledge, bringing the human capital. Nick, you are representing that right now. And all of the great resources that we have here at Duke to not just the service of the community, but the service of Duke as well, right? To work in partnership to build these incredible projects and initiatives that can really have a great impact in the world. So again, thank you so much today, Nick, Sumi, Diana, and Bob for joining us. We are incredibly in your debt and grateful for your willingness to share your wisdom and your experience today. I am going to put in the chat a link to an evaluation survey if participants would be willing to complete that for us so that we can know what you're taking away, what you enjoyed today, and if you have any feedback for us. I'm also putting a link to the Community Engaged Scholarship Collaborative website if you're interested in signing up for our newsletter to receive more information about these types of events. Again, thank you so much. Really appreciate it.